Hello, I'm Celeste Hemingway, the Program Director for the Obstetrics and Gynecology Residency Program here at Vanderbilt. We're excited to offer you an inside look at what our training program is like. We hope our tour video gives anyone who might be considering Vanderbilt a glimpse of what training here is really like. You'll get to see some important places, meet a few of our faculty and residents, and hear about the experiences our residents have. And although we know it's no substitute for an in-person visit, we hope that you get a sense of what a special program this really is, with our prioritization of the resident education experience and our overall sense of camaraderie. Being a part of Vanderbilt University means you get to take advantage of a beautiful campus and many opportunities. Vanderbilt Medical Center is a big and wonderful place to work. Nashville is a vibrant and growing city with something for everyone, and Tennessee is an incredibly beautiful state with amazing places to explore. We think that you will love being a part of Vanderbilt.
Hey there, my name's Sam. I'm one of the OB residents here. I'm here to talk to you today about our labor and delivery service, which I'm on that rotation right now. I'm really loving it. What's really unique about our service here in our institution here is that we work very closely with midwives as the intern. We work under their supervision, and several of them have decades of experience and lots of insight into the patients that we see here, which tend to be very complex. So we're handling a lot of sick patients with a lot of supervision and appropriate autonomy. I really like learning about their stories and what they do here and their sort of scope of practice and how that might differ from the MD, DO sort of scope of practice as well. One of the stronger assets is that we get this graduated autonomy. So overall, throughout this block, I've been able to feel a little bit more independent in what I'm able to do now that I've gained some skill. And gradually, as I go from this fall semester into the spring semester, I'll transition to the PROC service. And the PROC service is a rotation for PGY1s in their spring semester and the PGY2s in fall, who start to do C-sections under the supervision of a chief and get a lot of practice with that, handling complex readmissions in postpartum and getting used to that practice and kind of building gradually. So in the morning, we each postpartum round, each of the interns who are on night and day, and we're capped at 6. And I think that's really important because it helps you focus in on 6 patients. You're not overwhelmed by a flood of patients, and you really get to spend that quality time to understand their postpartum progress, any complex diseases like preeclampsia that are affecting their pregnancy, and how you manage that closely and watch them closely after they leave here. So I run through those 6 patients with my chief every day, and it really kind of helps to sharpen the quality of care that I give those patients because I have that cap. Twice a day, we also have board handover, which is done morning and night in a very multidisciplinary setting. So we have OB there, MFM, NICU, midwives, and it's really an important moment to collaborate, focus in, and talk about all of our sick patients. And we also do mid-shift safety rounds, both at noon and at midnight. And that also gives especially an appropriate time to check in if we're worried about patients who are either not progressing in their labor or who are very sick. It's a great opportunity to kind of bring everyone around. Those safety rounds are nurse-led, so it really brings everyone into the fold to talk about the best plan of care for our patients. The chief is a super important figure in the unit of L&D. They're kind of acting as a junior attending. They're supervising the MFM service, the PROC service, the L&D service, and they really touch base with each of us frequently, and it really kind of emphasizes this importance of team-based communication so that the chief is always aware of what's going on. They have a good deal of independence, and I've built a strong professional relationship with my chief. She's really helped sharpen my skills, and I know that my upper levels also feel the same.
Hi everyone, my name is Bowie Do, and I am one of the residents here. I'll be talking to you today about our MFM rotation. The mornings on MFM usually starts off with us rounding as a team that consists of a second and a third year resident, a fellow, our nurse practitioner, our attendings, and medical students whenever they are available. After table rounds, we usually would go to the bedside to round on each patient. With regards to our patient population, we have complex patients that come to us from all around Tennessee and also neighboring states like Kentucky and even sometimes Alabama as well. We not only tend to see complex obstetrical conditions, but we also tend to also see complex medical condition as a whole. And that usually exposes us as residents to multidisciplinary approaches to taking care of each and every one of our patients. With regards to education at MFM, we typically do conferences on Monday, Wednesday, and also Thursday. Thursday afternoons as well, we also participate in fiddle conferences with our fellows and our MFM attendings. With regards to cases that we participate in, we do things like C-sections, we also perform sarcologists, and are exposed sometimes to PAS cases where we might even be involved in cesarean hysterectomies as well. With regards to clinical exposure on MFM, we typically would rotate with our fellows where they get consults. We also do clinics with our MFM attendings in their diabetes clinic and also in their cardiac clinics as well.
Hey everyone, I'm Elizabeth and I'm an intern in the Obstetrics and Gynecology department at Vanderbilt University. On my family planning rotation, I learned how to utilize effective patient counseling as well as shared decision making to do birth control counseling. I did extensive LARC placements, including Nexplanons and IUDs. In addition to that, I performed NVAs, suction DNCs for early pregnancy loss as well as pregnancy of unknown location. And additionally, we did Beta Book, which is essentially how you manage pregnancies of unknown location, early pregnancy loss, as well as molar pregnancies. And then every week you will go over with interdisciplinary medicine with radiology as well as family planning and other family planning faculty to discuss the best treatment options for those patients. And in the springtime, I have an opportunity to complete an elective at an outside facility out of the state to get more hands-on training for abortion care.
Hi, I'm Emily. I'm a resident in the OB-GYN program at Vanderbilt, and I wanted to talk to you a little bit about what our clinic rotations look like. In your clinic rotations, you're going to see a variety of different clinics and be with a variety of different providers. Some weeks you'll do different OB clinics and then also GYN clinics. This really allows us to see a variety of patients, everything from new OBs and return OBs to acute GYN complaints, as well as doing things like contraception counseling or pre-pregnancy counseling. Another clinic that I really enjoyed was our colposcopy clinic. From day one, you get experience with managing abnormal pap smears, going to colposcopy conference where you get to talk about different recommendations and work through what would be appropriate for each patient. And then you also get hands-on experience doing colposcopies. We have multiple colposcopy clinics, and at times you can be in colpo clinic up to 2 or 3 times a week, really getting the hands-on experiences of doing colpos with the supervision of an attending with you. In our continuity clinics, we start first year getting experience mostly with new OB patients and return OB patients. You get to work one-on-one with an attending, really take ownership and have autonomy with those patients while also getting the guidance of an attending that sits right next to you. You get to really manage pregnancies, mostly normal pregnancies without many health complications, but also we do kind of graduate and get more responsibility as the year goes on and see more complex patients. When you see a patient, not only are you seeing them and taking care of them, but you're also responsible for following up on their labs and really managing anything that can come up in that pregnancy, which has been a really great experience and really furthered my knowledge and helped me better understand how the system works and how a lot of our care is really helping patients navigate the system, navigate things like appointments and ultrasounds, as well as sending prescriptions to their pharmacy and really taking care of them throughout the entire pregnancy. You'll also see different patients as far as GYN complaints in your continuity clinic. So you might have an acute GYN complaint, or you'll also do contraception in this clinic, whether that's postpartum contraception, we'll place IUDs or Nexplanons with all of the supervision of the attending. It's a really great place to learn, as well as really start to feel like you have ownership and are having autonomy with your patients. It's been a really fun experience for me, being able to see patients in clinic and then sometimes seeing them on the floor and getting to help deliver them. It's a real true experience of continuity, getting to take care of them in clinic and then seeing them on labor delivery and really getting the follow through of what happened with that pregnancy and being really able to care with them. Besides the bread and butter OB-GYN clinics that we go to, we also have a variety of specialty clinics that we can rotate through. Pediatric adolescent gynecology clinic, a vulvar disorder clinic, a breast clinic, an opioid use disorder clinic in pregnancy, ultrasound clinics, just to name a few. There's really an opportunity to see a variety of different kind of routine OB/GYN complaints, but also an opportunity to work with specialists and really hone your skills at a variety of different specialty clinics.
Hey, I'm Lindsay. I'm one of the residents. I'm going to talk to you a bit about the REI rotation at Vanderbilt. So this is a rotation that has a lot of clinical exposure to infertility management and treatment. At this point, I feel really comfortable in counseling patients about infertility and the various causes of infertility, as well as conducting the workup for infertility. So I know what questions to ask, I know what tests to order, and I've learned a lot about interpreting those tests as well. A lot of the clinical experience in REI is very procedural based as well. So I've gotten a lot of experience with transvaginal ultrasounds, and I feel much more confident picking up the probe at this point. I also get exposure on REI to saline infused sonar histograms and interpreting semen analyses, as well as procedures in the operating room. So I've had a chance to do more hysteroscopy on REI, including diagnostic and operative hysteroscopy. I've had opportunities to counsel patients about cryopreservation and pursuing IVF, and we also have opportunities at our partner site in Memphis to pursue more training in IVF if that's something that residents are interested in. Another part that I really have enjoyed about REI is the exposure to other endocrine disorders, so not just in the fertility setting. We care for a lot of patients with PCOS and also with primary ovarian insufficiency, so I've learned a lot about caring for those patients, not just in the fertility world, but lifelong. Our REI providers are also involved in transgender care, so I've had exposure to learning about gender-affirming hormone therapy and also caring for patients who are seeking gender-affirming hysterectomies and other surgeries.
Hi everyone, my name is Peyton. I'm one of the residents here at Vanderbilt in the OB/GYN department. I was going to talk to you all today about our GYN rotation. And I'm standing outside right now of some of our GYN ORs, and all levels of our residents spend time in our operating rooms on our GYN rotation. We start off our intern year doing a lot more minor cases and getting comfortable with the operating room, cases like exams under anesthesia, colposcopy, LEEPs, DNCs, and it's really helpful to kind of get the lay of the land back here. Then as second years, we rotate mostly with our minimally invasive GYN surgery department, and so we get an introduction to a lot of laparoscopic cases, more comfort with hysteroscopies, and also open cases with our minimally invasive GYN surgeons. Moving up to third and fourth year, our third years on GYN, we have someone who rotates and is kind of our flex person, so they get to do all kinds of GYN cases, often as well at our ambulatory surgery centers. And then our Urogyn third year operates full-time with our Urogynecology department. And then lastly, our chiefs, they get all kinds of surgical experience, but are also there to be teach assists and also second sets of hands as interns and second years kind of navigate their entrance to the ORs. We also have surgical fellows here. And so as a second year, you work very, very closely with the minimally invasive GYN fellows. It's great to have them. They're excellent teachers, and they also help you sort of, again, navigate the nuances of pre-op orders, op notes, post-op orders, and making sure that you're overall being super well supported on your MIGS rotation. Additionally, we have Urogyn fellows who you also operate with, and you'll round with both sets of fellows when you're on your GYN rotations. And they're great in between ourselves and the attendings. Another part of the GYN rotation is managing the floor and also consults. So for our floor work, each week we have an attending of the week. Sometimes that attending is from our generalist department, and sometimes they're from our minimally invasive GYN departments. And so they're with us from Sunday night through Friday, and they see all of our consults with us, and they round on the floor patients with us for those patients who have been admitted. They're an excellent resource also for add-on cases that pop up during the week. And in terms of our roles while we're on the GYN team, when we're outside of the operating rooms, our first year is responsible for managing all of our floor patients. So they make sure to round on the patients and see how they're doing each morning, and then round formally with our attending of the week. Additionally, our intern is responsible for accepting consults, and so they get a great tour of the whole hospital from the ED to patients admitted here at Vanderbilt that we are consultants on. As a second year on the GYN rotation, you mostly spend your time in the operating rooms, but you're also available to the floor person, and you also take consults if your intern is on vacation or in clinic. As a third year, you primarily rotate on the urogynecology rotation, and one of our residents will tell you more about that rotation as well. And then lastly, our chief on the rotation is in charge of just making sure the whole team runs smoothly. That person signs the cases each day and also make sure that all of the members of the team are supported and are an extra set of hands at all times during the day. And then also while we're on the GYN rotation, each week we have weekly didactics that range in topics, again, from pelvic infection to preventing surgical complications. And so we get to do that with our minimally invasive GYN faculty each week.
Hi everyone, my name is Samita and I'm one of the residents here at Vanderbilt, and I'm really excited to talk to you about the urogynecology experience here as residents. So in terms of a timeline, our urogynecology experience starts during our second year during our focus block in the clinic. We get really close one-on-one time with the attendings to start learning how to stage prolapse, to see various in-office urogynecology procedures, and learn how to prepare a patient for preoperative evaluation and counseling through their surgical experience. We then start kind of the bulk of our surgical experience in our third year during our gynecology rotation. We spent 8 weeks working really closely with our amazing attendings as well as our 3 fellows, learning exactly how to do transvaginal hysterectomies and how to start learning how to do different repairs as well as incontinence procedures. We have 3 amazing fellows, like I mentioned, and they serve as surgical educators and clinical instructors and really make our experience on the rotation robust. So you'll have several opportunities for various conferences throughout the week. On Fridays, we have our preoperative conference where we prepare 2 weeks in advance to make sure the full surgical team has reviewed all of our cases and that our patients' medications are optimized and that we feel really confident about our surgical planning. We also have urogynecology specific didactics as well as joint urogynecology and urology didactics on Wednesday mornings. After that, we spend the bulk of our time with our fellows and the amazing surgical team learning how to operate, and it's a great experience overall. You're gonna have a blast.
Hey, I'm Megan. I'm one of the residents, and I'm here to talk to you about the GYN oncology rotation, which we do all 4 years here. With regards to those roles, our first years generally manage our floor patients and everyone who's admitted with the help of the second year and the fourth year. The first year resident will round on patients every morning, will present them on rounds, and will follow up on all necessary tasks throughout the day. They also help care for our post-op patients. The second year does a little bit more of a hybrid role. They'll spend some time rounding in the morning with the first year resident. They'll also continue to take care of floor patients during the day. They will also have a mix of OR cases as well as clinic days. The third year resident is very surgical. They spend most days in the OR doing everything from laparoscopic to open to robotic cases. And then the fourth year resident is more hybrid again. And so they'll do both surgical cases as well as overseeing the floor work and being there as kind of a source of guidance for the lower level residents. Surgically, second, third, and fourth years do go to the operating room, and they will kind of go through a robotics curriculum with the gyn-onc rotation. So this is where we get most of our robotic training at Vanderbilt. Starting second year, you're kind of bedside for cases and start to do your modules with our simulation training, and then third and fourth year is when you really sit at the robot and can choose to become more proficient in that training. So the team on gyn-onc is comprised of the 4 residents, 1 from each class, as well as Robin, who is our amazing inpatient nurse practitioner. She is available for all of our questions and is incredibly helpful and knowledgeable and funny and nice. Aside from that, we have 7 faculty members here who we work with both on the floor, in the OR, and in clinic. And we also have a fellow this year, which is new. We'll have gyn-onc fellows who help both on the inpatient side of things as well as in clinic. And the fellows do take call and are really a great resource for us so far. Regarding our didactic curriculum, we have a self-guided didactic curriculum online with videos and resources that we can go through at our own pace. And those are kind of level specific, so different levels, different years will cover different topics. We also have tumor board each week where we discuss with our pathology team kind of discuss the cases that have come up, and we also have a pre-op conference where we discuss patients who we'll be seeing in the coming weeks. So those are all great learning opportunities aside from the learning we get every day on the floor.
Hey guys, my name is Chelsea Fector. I'm one of the 2 assistant program directors, and I have the pleasure of letting you guys know a little bit more about our educational programming within our program. Our programs that we have are widespread and incorporate a lot of different styles of adult learning. The varying techniques that we use include cadaver and industry-sponsored labs, flipped and reverse classrooms, simulations, podcasts, and in-person lectures. We also have protected didactic time on Fridays for our residents that span a course of 3 hours, which cover the breadth of our specialty. Additionally, within our rotations of labor and delivery, maternal fetal medicine, colposcopy, REI, GYN, urogynecology, and gyn-onc, we have a curriculum specific to each of those specialties that is throughout the course of your residency, so you have a graduated curriculum with each year that you're there. Also within the resident schedule, there are focus and elective blocks built in that allow the residents to really hone in on particular areas of our field that they're interested in, and there's a lot of one-on-one teaching experiences during that time. If solo learning outside of your normal day-to-day job is more your style, we do have a Vanderbilt built website that has a catalog of all of our resources, and it also hosts lectures that have been previously given by our faculty, so they're always available for you at any time. And then if group learning is more your thing, we do host a monthly journal club at one of our attendings' houses. It kind of rotates every month. And it's a great opportunity to practice evidence-based medicine. Every time we cover 3 articles of the up-and-coming research. And then if learning and teaching in the community is something that you're interested in, our residents can also volunteer with a supervisory role at our medical student shade tree clinic. And a lot of our trainees really do enjoy that opportunity to give back. And then lastly, a simulation is one of what I'd like to think is one of our strong suits, because that's what I like to do a lot of. Our simulation curriculum does span all of the breadth of our specialty to include hands-on learning in obstetrical emergencies, outpatient procedures, and gynecologic skills. In the simulation realm is where you're going to find me the most, hence what you see back behind me.
Hi, I'm Samantha Blyle, Assistant Program Director. I want to thank you so much for considering Vanderbilt for your obstetrics and gynecology training. If you have any questions, please feel free to reach out and ask. We hope we see you soon.